Spencer Animal Hospital is a clinic that was opened in 1995 in the town of Spencer. Originally, it was a house, and the clinic was converted into a small clinic that would be able to care for clients and their pets in any way that they needed. It's ran by one doctor, Dr. Sullivan. It's a general practice or a small animal clinic that the patients are mostly canines and felines, but Dr. Sullivan also does see some avian patients because she has a bird herself, so clients feel more comfortable with bringing their birds to her. She also offers surgeries like spays and neuters, dentistries, but she also does cruciate repairs and mass removals. And they also offer laser therapy, and if the surgery is too big for her to accomplish, she will refer them to Colonial or Cornell. The entire house is used for the clinic. The upstairs is mostly used for the reception, lab area, surgical suite, treatment and exam room, and we also have cages for animals to recover from surgery. And the basement is used for radiology, dentistries, and grooming. The first picture on the left is the reception area, and this is what you see when you come in through the front door. There's chairs and magazines for you while you wait for your appointment, as well as a reception desk, and medical files are there for the receptionists of the day to go and get it. The middle picture on the left is all the supplements that we can carry for our clients. So there's ear solution, flea and tick prevention, heartworm prevention, collars, harnesses, Feel Away, Adaptil, and VetriScience supplements. In the middle picture on the right side is an overview of our lab area. So we have a refrigerator to keep our FIV tests, Parvo, Giardia tests, as well as our 4DX. And on the last picture on the right side is a closer up image of the lab side of it. So we have the microscope that we use for the fecals, urinalysis, ear cytologies, as well as we have machines that run CBCs, T4s, and PVCs. On the picture on the left is the surgical suite where we perform all of our surgeries except dentals. So we do spays, neuters, cruciate repairs, mask removals, and much, much more. And the middle picture is also where we keep the animals who are waiting for surgery or recovering from surgery. And animals also spend the night for spays, so we can also keep them here overnight. And the last picture on the right is just a different angle of the room. So we do have an exam table in this room where we can do sedation and clip the surgical site as well as insert endotracheal tube, and then we bring them over to the surgical suite. In this picture, I thought it was really unique that Spencer Animal Hospital did not have a separate room for exams and treatment. So most clinics in my area don't usually have this. They usually have 2 separate rooms. But I've discovered that the owners that go to Spencer Animal Hospital really like to be able to see what's being done to their pet. So we always ask if the owners are needle shy or don't like the sight of blood. prior to us following through any procedures like vaccines or drawing blood. And if the owner does not want to see the procedures being done, we can easily move the pet into the surgical suite or the recovery room where we could quickly do what we have to do. And if not, then we do it in the room with the client present. Dr. Roxanne Sullivan graduated from the University of Illinois back in 1998. When she graduated in veterinary school, she started working in a variety of clinics back in Illinois, and then when she moved here, she worked at numerous different clinics as a floater vet and filled in where clinics needed her. And when she realized that she wanted to open her own clinic, she started looking for locations, and she found Spencer, New York. Unfortunately, Spencer did not have a vet at the time, and the closest vet was in Ithaca, Waverly, or Candor, which meant the clients would have to drive at least 15 to 20 miles to get to the nearest vet, and that's pretty far if there's an emergency or if the owner didn't have transportation to get that far. So in 1995, Dr. Sullivan opened her own clinic in Spencer and has been there ever since. She runs a one-doctor practice. She has one licensed vet tech and 4 vet assistants that helps her run her practice. While at Spencer Animal Hospital, Dr. Sullivan had me doing numerous things like fecal tests, ear cytologies, dispensing medications, med math, lab work, and restraining, as well as she challenged me and allowed me to attempt my first dental, radiology, and she was more than willing to allow me to scrub in the surgeries and assist her. She even let me put in sutures during the cruciate surgery. Morgan is a graduate from SUNY Delhi. She graduated in December of 2017, and she became a licensed LVT on July 16, 2018. We were very excited for her. Morgan did her preceptorship at Spencer Animal Hospital as well as I, and when she graduated, she returned to work full-time at the clinic, and she has been working as a tech assistant until recently when she passed her VTNE. Morgan's job at the Spencer Animal Hospital is to give vaccines, dentals, draw blood, run lab work, fecals, dispense medication, and much more. She's also a receptionist. She answers questions that clients might have. And while my time there, Morgan showed me how to run CBCs and numerous different tests, because at Briar Patch everything was sent out to a lab, where at Spencer Animal Hospital we did everything in-house as much as we could. And Morgan showed me all the different ways to do that. She showed me how to place endotracheal tubes, give pre-anesthetic medication, as well as laser therapy and prepping the patient for surgery. Penny has been a vet assistant at Spencer Animal Hospital for the past 17 years. Penny is like the unofficial office manager. She's the one who makes sure everything runs smoothly and the clients are happy with their experiences. She also works and runs the front desk on Tuesdays and Saturdays when she works, but she also restrains during exams, wraps surgical packs, and helps monitor anesthesia. Penny will also run fecals. She'll get the fecals started. She'll have them spin down for us to look at. She can also set up 4DX tests for us and awaits for Dr. Sullivan, Morgan, or while I was there for me to read the results. While at my time at Spencer Animal Hospital, Penny showed me how to wrap surgical packs, take phone calls, and schedule appointments. Netta is also a vet assistant who has been working at Spencer Animal Clinic for 10 years now. She is actually Penny's daughter. At the clinic, Netta does numerous things from grooming to restraining, working the front desk, scheduling appointments, dispensing medications, and she also helps monitor anesthesia during surgery. While at Spencer Animal Hospital, Netta taught me how to calm down upset clients, as well as she helped me learn how the clinic ran and how things were done, and their procedures or protocols, and how their clinic was ran. Pat is a veterinary assistant who has been working at Spencer Animal Hospital for the past 7 years. Pat mostly helps with the front desk, but she also helps with the appointments by restraining for Dr. Sullivan. She also monitors anesthesia and helps monitor patients who are recovering from surgery. While I was at Spencer Animal Hospital, Pat always gave me the confidence while I was attempting new techniques. She also showed me how to monitor patients while they were recovering from surgery, as well as what to watch for, like their breathing, and making sure that they were warm enough. Last but not least, Belinda. Belinda is a vet assistant who has been working at Spencer Animal Hospital for the past 9 years. And not only is she a vet assistant, but she is also a groomer. So when she has extra time throughout the day, she has clients who comes in for her to groom their dogs for them. At the clinic, Belinda helps run lab work, wrap surgical packs, dispense medication, and she also cleans the kennels and monitors anesthesia. Belinda showed me how to operate the autoclave as well as the ultrasonic cleaner. Also, while I was at Spencer Animal Hospital, Belinda showed me how to file the patient records, since Spencer Animal Hospital is only half digital and the other is still on paper. Last but not least, I can't forget about the clinic critters, or the better yet, the welcome committee. So we have Moogie, who's an African gray parrot, and she's actually Dr. Sullivan's pet parrot, and she comes back and forth to work with her. So she likes to chirp and whistle at people when they come in. Then we have Kishka, who was actually a kitten who was abandoned because he had a prolapsed rectum. So Dr. Sullivan performed surgery and now he's all better, and he's an avid hunter and he loves to steal the show whenever somebody's at the front door or the front desk. Einstein, now he's the special kitty of the clinic. He was actually a feral cat who had a bad reaction to a sedative and he died. And they performed CPR on him, and luckily they revived him, but unfortunately he was deprived of oxygen for too long, and he is now blind, and he actually had to relearn how to basically be a cat. So it's actually quite impressive to watch him get around the clinic, and he loves to be picked up and he loves being loved. And we also have who we call Mr. Possum. He was brought in to us by a client who found him in their back lawn, and upon radiographs that I took with Morgan, we noticed that he possibly may have had a broken back when he was younger, and he had some nerve damage in his back legs, or so Dr. Sullivan believes. So he's not able to climb like a normal possum. So Dr. Sullivan is on the task of trying to find him a home at a nature center where he may be used for education purposes. Rosie is my first case study. Rosie is 10 years old and 4 months. She weighed about 19.4 pounds or 8.81 kgs. She is a Dachshund Cardigan Welsh Corgi mix, and she is a female. So here's a little history on Rosie. Rosie's original owner, who had her up until she was 8, had to give her up because she had to be moved into a nursing home. So the new owners brought Rosie in for a health exam, and Dr. Sullivan realized that Rosie had pretty bad dental disease and she was also unspayed, which caused her to still have heat cycles, and for the new owners, the heat cycles were very difficult for them to deal with. So while she was going to get dental cleaning anyways, the new owners decided to also have her spayed. After her teeth were cleaned, she was prepped to be spayed, and while we were clipping her, we actually noticed a scar approximately where we make the incision for a spay. And Dr. Sullivan, prior to starting the surgery, was concerned that she actually had been spayed, but we just didn't have any record of it. So we called the owner, and she said that she did have heat cycles, and Dr. Sullivan realized that the scar was actually from a hernia repair when she was younger. Once we determined that Rosie was still an intact female, Dr. Sullivan proceeded with the spay. While Dr. Sullivan was locating the uterus and ovaries, she had noticed a few uncommon things. The first one was Rosie's uterine horn on the left side had actually been fused to the large intestine, which Dr. Sullivan suspected that she possibly had a litter and it could have ruptured, and that was just the way that her body healed itself, and it fused to the large intestine while it was healing. And the second uncommon thing was that she had what looked to be water droplets on her uterine horns. These water droplets actually turned out to be serosal cysts. Once we were finished with the surgery, Dr. Sullivan and I went and looked up what these were, and Rosie actually had 3 on her uterine horns, 2 on the left side and 1 on the right side. But Rosie did well through the surgery and recovered well, and there's no other concerns for the owner to be concerned about the cysts since they were removed. These serosal cysts are more commonly found in older intact females, mostly due to the postpartum uterine involvement and rapid contractions during the heat cycle due to high levels of My second case study is this turtle. Late on Thursday, August 2nd, we had a client bring us a wild turtle which was found on the side of the road, which had appeared to be a HPC or a hit by car, and Dr. Sullivan never turns away any animal or animals who need help, so she took him in and we repaired him the best we could. And on the bottom picture on the right is actually the container we kept him in while placing him in another metal cage. This is actually a litter pan that we used so we could put water in it. Dr. Sullivan went home and got some rocks so he could climb up on that. And we also got turtle food for him for his time that he was staying with us at the hospital. And we also had to put some saran wrap over the edge of it so he couldn't climb out and injure himself any further. The breed of the turtle is a Chrysemys picta, or better known as a painted turtle, and unfortunately we did not know his age or his sex, as for turtles are very difficult to be able to identify their sex and age. For the turtle, we approached everything in steps. So step 1, we washed off the shell by rinsing him underwater underneath the faucet to clean out any debris that may have gotten in where his shell was cracked. And also that's when Dr. Sullivan assessed the damage to the shell to see if it was going to be able to be repaired. Step 2, we gave the turtle meloxicam and Baytril every other day to help prevent infection and also give him some kind of pain relief, which we only gave a drop of since Dr. Sullivan was unsure of the proper dose to give a turtle. Also, that's step 2 is where we wired the shell together to prevent the shell from becoming any more damaged or unattached with 28 gauge wire that you use to repair jaws. And he kept, every time he would move, his back feet would keep catching the damaged part of his shell, so we wanted to be able to give the shell some stability so it wouldn't completely come off. And step 3 was to repair the shell. So we applied epoxy and a piece of fiberglass to give the shell some support, and we repeated that step 2 times. These pictures are showing the step 2, which was us wiring the turtle shell together so he wouldn't cause any more damage to his shell with his back feet. So in the first picture on the top of the left, this is showing Dr. Sullivan using a dental drill to puncture the shells and create little holes so the wire could fit in and could be tied together to hold the shell together. And the picture in the middle on the top row is a closer picture of the holes that we created to put the wire through. The picture on the right side is Dr. Sullivan placing the 28 gauge wire and tightening it with forceps. And the bottom picture on the left is a close-up of the turtle after the wire had been tightened and the access was clipped off. And also on the bottom is the Baytril and meloxicam that we used to help treat for any pain and infection. These are pictures of step 3. So as you can see in the top picture on the left, this is the epoxy that we used on the turtle shell. The second picture on the left is Dr. Sullivan fitting and shaping the fiberglass to put onto his shell to make sure it didn't overlap the edge of the shell. And also, I did not even know this, it's better to cut fiberglass in rounded edges so the fiberglass doesn't actually fall apart. And the third picture is Dr. Sullivan carefully applying the epoxy to the shell. We had to be very careful of not getting the epoxy in the wound of the skin underneath the shell, so we carefully went along the edges. And the fourth picture is Dr. Sullivan applying the fiberglass onto the turtle shell, and that's also what the bottom picture on the left shell is Dr. Sullivan applying pressure to make sure it was nice and flat to the shell. And the second picture on the bottom is after we applied another layer of epoxy on top of the fiberglass to really get it to securely fix to the turtle shell. And the very last picture on the right side on the bottom is after we did this process 2 times and allowed it to dry for 4 hours. So now it's waterproof. So actually, after we allowed it to dry the next day, he went to a turtle pond at a client's house, and he's going to hopefully heal nicely, and the epoxy and the fiberglass will come off as he grows and the shell starts to shed off its sections of the shell. My third case study is Rocco. He is a male 4-month-old Chihuahua who weighed 4.2 pounds or 1.9 kilograms. Prior to coming to Spencer Animal Hospital, Rocco, the night before, jumped out of his owner's arms and got injured. His owner had brought him to the Candor vet, where he was told that Rocco had only sprained his left front leg. The owner felt that he needed to be watched while he was at work, so he left him with a friend for the day, and Rocco did the same thing. He jumped out of the friend's arms, so the friend brought Rocco into Spencer Animal Hospital to get his leg looked at after he landed on the floor and cried. After evaluating Rocco, Dr. Sullivan decided to sedate Rocco in order for us to be able to take radiographs and to assess if there were any fractures in his right leg. Using dexmedetomidine with diazepam and butorphanol, we sedated Rocco and gave him some pain relief due to the fact that he was in pain and we would have to manipulate his leg more for the radiographs. Once Dr. Sullivan reviewed the radiographs, it was clear both the ulna and radius in both the right and left front leg had compound fractures. As you can see on the pictures on the left side with the arrows on the top, you can see the fracture more clearly in the right leg than the left leg, mostly due to the fact that the left leg had already had swelling around the leg from the night before in that other injury. And on the bottom left is a picture that's more blown up of the left leg, so you can try and see the fracture in both the right and left leg. Dr. Sullivan gave Rocco's owners two options. Option one, which Dr. Sullivan believed was the best option for him, was to be referred to Colonial Veterinary Hospital for orthopedic surgery because of Rocco's young age and the type of fracture. There are both pros and cons to option one, the pros being the bones would properly be aligned and surgery would give Rocco the best chance of healing properly, and there would be no splints or bandages required after surgery. And the cons was it's a very expensive surgery and there's a risk of infection after surgery. The second option, Dr. Sullivan said that she would place a Robert Jones bandage on each leg in order to keep his legs immobilized for at least 3 to 4 weeks to allow the bones to heal. The pros for the Robert Jones is it's cost effective, there's no hospitalization time, there's a low risk of infection, and it helps immobilize the fracture, which also helps reduce pain. The cons are the bones may not be properly aligned, so he will have curved front legs. If the bandage gets wet, it could cause skin dermatitis. If the bandage is wrapped too tightly, it could cause tissue necrosis, because of the lack of blood supply to the lower extremities. And the toes must be closely monitored for swelling. And also the bandage will have to be changed due to Rocco's growing rate.
And put another layer on the inner side. And the popsicle stick is just so that the ends don't stick together while we're working on it. Okay, so now we're going to have somebody pull the leg fairly straight.
Okay, so
we can get this to be straightened out a little. Okay. And then we do cotton wrap. Where's your toes? You want the toes to still be out so that you can monitor for swelling. And you have to wrap above the joint above, which is the elbow. Now it looks like a ridiculous amount of wrapping, but we're going to squish it down with gauze. Oh, I need that wrap. The squishy part, and you are actually pretty tight. This is what stabilizes the leg. Sorry. So these are nice because you can take them on and off as you need without specialty saws and stuff. The only bad part about them is you can't get them wet. Fiberglass casts you can air dry with a hairdryer. These not so much. And my tape did not stick to the popsicle stick. So this is the way to keep the bandage from falling down and incorporate the tape back up on itself. Sorry.
Maybe I take two out.
And then we'll do a green wrap on top to keep puppy from. So this they can watch their toes for swelling every day. And it's just an outer wrap to just keep it neat and tidy. Sometimes we sign them like real quick. All right, now we need to flip and do the other one.
On the left is a video of Rocco receiving his Robert Jones bandages. Because Rocco got the Robert Jones bandages, we have special discharge care instructions that we had to tell the owner to watch out for and how to care for the bandages. But overall, we had to control Rocco's pain levels. So we couldn't give Rocco meloxicam or any NSAIDs due to his age. So Dr. Sullivan prescribed Tramadol, 1/8 of a tablet by mouth 3 times a day, with food due to his weight. The owner also was told that he must watch his toes for swelling, because if the bandages are not loosened enough, it could cause necrosis, which could cause the loss of a limb. Also, the bandages must be kept dry, and if the bandage gets wet, it needs to be changed to prevent skin dermatitis. And the bandages will have to stay on for 3 to 4 weeks on strict rest, and once the bandages are removed, he will have to be on crate rest for 1 week prior to resuming low activity. At Spencer Animal Hospital, my role or my position was a technician and a intern. To the clients, I was introduced as an intern from SUNY Delhi. Dr. Sullivan was always challenging me with new techniques or challenging me with reusing techniques that I learned in school. I gave the core vaccines. I ran lab work like fecals, ear cytologies, skin cytologies. I drew blood from the cephalic and the saphenous and attempted the jugular. I trimmed toenails on both cats and dogs. I dispensed medications, controlled and non-controlled medications. I restrained, performed a dental on a Yorkie Terrier. Radiology, I got to help take x-rays of a possum, the Chihuahua Rocco, and also a kitten. I monitored anesthesia, placed the endotracheal tubes in a boxer, a dachshund, a cat, and a cattle dog. I gave sub-Q sedatives, wrapped surgical packs, performed laser therapy after spades and neuters. I made appointments, scrubbed in for surgery, and I even got to help suture the muscle layer for an cruciate repair. Needless to say, I learned a lot this internship. During my time at Spencer Animal Hospital, I had a great experience and learned even more than I had anticipated on. At the start of my preceptorship, I felt a little more confident since I had already completed the preceptorship, but I quickly realized that Spencer Animal Hospital and Briar Patch Veterinary Hospital were completely different from one another. I soon realized that differences in between the two clinics weren't a bad thing, but a great opportunity to learn the differences in clinics and clients, since each veterinary hospital are going to have different protocols, different patients, and different types of clients. At Spencer Animal Hospital, all the lab work is done in-house, or if it's like a biopsy or allergy testing, it's sent to Cornell. In Spencer, New York, the clients don't have much money since Spencer is a poor economic area. So Dr. Sullivan is incredible in that she works with the owners so their pets get the treatment that they need. Dr. Sullivan works with the clients by working within their budget, and she even lets the owners pay overtime with a payment plan that Dr. Sullivan sits down and creates with the clients. Everyone at Spencer Animal Hospital were more than willing to give me the opportunities to learn and try new skills. I also was more than happy to learn from the employees, knowing that they have learned and practiced for 7+ years of experience. With another great experience in small animal practice, I am more seriously considering working in a small animal clinic. Once I graduate and become a licensed tech, if I have the opportunity after graduation, I would consider working at Spencer Animal Hospital because Dr. Sullivan and all of the other employees were more than a great team to work with and a great environment to learn from.